Donc, c'était très intéressant. Let's move to the next bridge with a full professor who is an active leader in the field of general obstetrics and gynecology. Please, put your hands together for Dr. Sony Singh.
So thank you so much. Bonjour, merci pour l'invitation. I look forward to presenting just for 15 minutes a little bit of a clinical perspective. I came actually with three feelings today. I came with one, which was anger, that I still am frustrated with the fact that women, Black women in particular, have to struggle and suffer the way they have, despite having been in this career for over 20 years and seeing it even in my whole lifetime from my own personal experiences. Then I came with fear, the fear that we may not change, that there may be nothing that we can do and that we will just continue to live this problem that is not just 10 years old, 20 years old, it's hundreds of years old, potentially thousands of years old. Finally, Professor Sinha and others in the center gave me hope. That was my final feeling, that we can make a difference. So today, every speaker, the passion, the compassion in this room motivates me that we do have hope that we can make a difference. So I come to you as a clinician who works in a space. I don't do general obstetrics and gynecology. I do what we call complex gynecology, which is where, unfortunately, many of these women live. So I'm going to tell you three stories. I'm going to start with Angela. She's 35 years old, who presents with a lifelong history of heavy periods, pain, and a growing belly. She's anemic and is always fatigued and losing her hair, but doesn't know why. Does anybody here know why? Have you heard of anything called uterine fibroids? So guess how many Black women, percentage-wise, are living with uterine fibroids? Just throw out a number. 40%? Good guess. That's pretty high. Do you have a guess? No? 60, 70? Go higher. 80% of Black women have uterine fibroids. Fortunately, only about half of them, 40%, are symptomatic. So many are living with them and don't even know. Now, what about this story? Is this one familiar to you? So Janelle is excited to have her first baby after trying for years. She is 6 months pregnant, but she is worried she may not be treated the same as her white friends based on stories she heard. Does that sound familiar? And it was actually Jude who came to me and said, Sony, you know that in Ottawa there are Black women who are fearful of coming in to give birth. And I broke my heart to hear that. In my own department, I became department head about 4 years ago, in a department which was led by Dr. Carl Nimrod, who passed away in 2006 at age 56, the first and only Black leader who led a department of obstetrics and gynecology, a great man who did wonders for maternal fetal medicine. How would he feel if he heard that today? The next story. Deborah is 19 and has been suffering with period pain since it started. She's missed so much school, she has to take an extra year. She feels everyone thinks she's making it up, and she's been told it's all normal. We heard that this morning. That is the essence of why I do what I do. It's the essence of why we are all here. So I think that you know that fibroids are very common, and I've told you that as well. And they're actually the most common pelvic tumor, resulting in major hemorrhage, anemia, infertility, and the burden of disease is overwhelming. Now, I've asked some of you in the audience if I could show a video. For some of you, it may be very difficult to watch, but I need you to see that when we talk about these tumors, we're not talking about small tissue or small things that are happening. We are talking about a massive burden of disease that affects Black women disproportionately. So this is one of our patients I was called to help with. She wants to have babies. And as you can see here, we'll hit play on the video. That is probably 5 or 6 times the size of a normal uterus as well. Do you mind hitting play? But that was just the beginning if you look at her fibroids. Here, we'll go back. Right there, thank you. And we'll just let it play there. But wait, after you take a look, there's a lot more. That is her ovary, that little white thing. Look how massive that, she's been living with this mass inside of her. She wants to have a child. So we did our job, we took out 68 fibroids and tumors you'll see in a bucket shortly. She wasn't making this up. This just didn't happen overnight. Yet, guess where this is on the list of priorities? With our federal government or our provincial government, with this level of burden of disease, with this many women affected. Guess where it is? Nowhere. Guess how long these patients are waiting on my list for surgical care right now? Years. I just got an email this morning from a patient who's been waiting since 2022 to have her surgery, and she wrote me, I give up. I don't want any more care from the healthcare system because I've waited so long. And if we take a look at these issues with the wait list, the fact that it's not prioritized, little to no research except for some wonderful work that's going to be coming from our group here. And you're going to hear from Professor Ottawa soon. And a little bit about my week. So this is actually my patient who came to me from Toronto years ago, 2014, on the front page of the Toronto Star, who had a massive fibroid, and she just wanted to keep her uterus. It took us only an hour to remove the uterus because up till that point she was told she has to lose her uterus. There was no other option because imaging is poor. You heard that this morning, and it still continues to be poor. She was dismissed as not being reasonable. Yet we did it for her, the story was shared, and then it was put aside. And in terms of my week this week, on Tuesday, I took out an 8-pound mass that this young woman was living with, and of Nigerian descent. And then she's up on the floor. Last night I went to see another patient, and she goes, is that other patient there Nigerian too? I walked over. That patient's been admitted for over a week with massive fibroid burden, transferred to us because she needs urgent care for her fibroids that are all the way, both patients, up until their chest. That's how big these masses are. Can you imagine? What about the Black mother? In the US, we know they have a higher morbidity and poorer outcomes and risk of complications. And they face persistent and multifaceted disadvantages in healthcare access, morbidity, mortality, and their children do as well. And what about the statistics that we see from the US as well? This one shows us that overall, severe maternal morbidity is much greater in the Black population. In my own practice, remember, I only do complex cases. I really believe in providing alternatives to obstetrical care, such as midwifery, which we have zero access to. Everybody's got a waiting list, or family doctors. And so I focused on complex surgical care. As a result, I see some of the most difficult cases ever. The only 2 patients I've had die who have been in my care are both Black women. One was a woman who had that big fibroid burden, but she refused surgery. She would come into my office. I would treat her like my sister. I begged her to please let me help take care of you. She said, I have no family. I work in a hotel, and I'm bleeding away, but I cannot have surgery. So what I did is I gave her compassion and supported her to the point where she got so ill that she passed away. And that was a system issue. That was more than just the medical issue. It was a system issue. And yet I wanted to support her despite that. And I would call her my sister every time. She would call me her brother. And to watch her pass away from a disease which we know has no priority right now, but must have priority. And the other patient was a patient who had severe preeclampsia in pregnancy. I was called to do her surgery to get the baby out because she had big fibroids. But it wasn't that she passed away with. She passed away from a medical complication of pregnancy a few days later. It broke my heart as well to see that these women who we know are at higher risk are not getting the same access to care. So we should have universal health care, right? We shouldn't have a difference in morbidity or mortality. But our own researchers here in Ottawa showed that despite that, Black women are at higher risk as well. And systemic racism drives poorer outcomes. And I told one of my colleagues, I said to her, and I did it inappropriately because I thought to myself, a Black physician, and I appreciate our Black physicians, would understand. I said to her, please help me. Jude's told me that our patients are suffering, that our Black patients aren't getting the care. She says, no, Sony, you're wrong. Black women are taken care of. My colleagues would never be racist. So within our own system, not even recognizing that, and that broke my heart. That reason I'm up here, I'm not Black, I'm not a woman, and somebody asked me, why are you presenting at the Black Health meeting today? Because I will use my voice to stand alongside my sisters, to do whatever I can. And frankly, when you get to a certain point, you just don't care anymore. And I will wrap up soon, but just to point you to a great article out of Toronto, 25 women who were interviewed about their experiences. The racism is real. What Jude has told us is real. We have to lean in. So every time I walk through the hall, and you probably do this too, I see color. I walk and I actually lean in to that Black patient. I actually make that effort to understand where they came from. You shouldn't step back. You shouldn't be afraid, what I tell my colleagues, to ask about the background, to ask about experiences. People appreciate it when you see them for who they are, and that's what I did last night until 9 o'clock at night, talking to both patients who were in the same room with the same burden of disease. One crying because she hoped to have children in the future, the other one just recovering from a massive surgery that we did. And there are differences. We have Black Maternal Health Week, which has been identified in Toronto to make a difference by strong leaders. And finally, endometriosis. This is where I spend most of my time. We were told that Black women don't get endometriosis. It was in our textbook. It was only a disease of white women. It wasn't complimentary to white women too. It said because they didn't get enough attention from their husbands. And so we wrote a paper that pointed out the racism that exists in this disease as well. But I tell you, this poor patient who was a refugee, she came to us via Burundi. That big red thing in our virtual reality image there is a massive tumor. She's young, she's in her early 30s. She has a permanent colostomy because we cannot resect this tumor. Her left kidney is dead. Black women can get endometriosis. She's living in a shelter now, has very little money, cannot afford the medications that we want to give. But there is hope. As I finish up, we have Endo Black, a great organization I've been able to interact with in the US. I was on US Capitol Hill before Trump, where we worked with colleagues to advocate for advocacy for endometriosis. We got our first grant to look at ethnic and racial differences in disease because Black women are different, and we need to help identify how to personalize care and not treat everybody the same. The burden of disease is not the same. So there is hope. So I want to thank you for allowing me to share our experience.
Thank you very much. S'il vous plaît, est-ce qu'on peut applaudir une fois encore pour Dr. Sony Singh?